Hello, good evening. We are glad you could join us for this special edition of Doctors on Call. It's a program which comes to you every second Sunday of the month, and it's really special to us because, guess what? Today, we are marking 5 good years since Doctors on Call was initiated, and we are really grateful to God because of the far that He has brought us. We are also grateful to all our partners out there and all those who have supported us, who have given us even financial support to keep Jesus on the airwaves and even to keep this wonderful program on the airwaves. Keep it up. And even we are glad to our doctors, our panel of doctors, who have also been able to help us even in this program. And what normally happens to this program, we normally bring you a panel of medical doctors in the studio, and not just quacks. We bring you experts in the studio to tackle all your medical issues. And today in the studio we have Dr. Catherine Mutisya, who is a clinical psychiatrist, and we also have Dr. Collis, who is a food specialist, and we also have Dr. Casey Wafula, who is a pediatrician, and Dr. Bridget Monda, and Joanne, who is in Studio B, and she's ready there and to pick up your questions. So moving on right now, Dr. Question here. Hi, doctor, or Dr. Wafula, please help. My son is 8 months and has eczema. Please tell us the cause and how it can heal. I have visited several doctors and now I'm helpless because we've been told to stop giving him dairy products and nothing that has wheat. Please help.
Let me just mention, one most important thing, that eczema is allergy of the skin. I think that's the most important thing. And we know that there are 4 allergies. We have allergy of the skin, which is eczema. We have allergy of the eyes. In medical terms, it's called allergic conjunctivitis. Then you have allergy of the nose, which is allergic rhinitis. Many people will say they have sinuses and they keep sneezing in the morning. And when you sit in their car, you think you're going to get swine flu because they sneeze the entire morning. But then they dry by about 10. Then the last one is asthma. So these are the 4 allergies that are common. Now, eczema comes in very early in small babies, and there are many things that could do that. One, I suspect that the baby is 8 months, and it may have started when the mother started weaning the baby. You remember these days we start at 6 months. But she says she's seen many doctors. Who is the best doctor to see eczema? I keep saying it's just the simplest doctor that you have in your neighborhood can see eczema. And unfortunately, for many skin conditions, what we use is the same. When you see eczema, many of the doctors want to give it steroids and it gets better, but then it comes back because the causative agent, the one which is triggering the thing to come, is not excluded. And that's why they try to do dairy products. But I keep telling mothers, when I see eczema, what I do is first of all tell the mother that it may recur. And 8 months is a good age. It goes on and it will burn out. You don't really have to be very aggressive with it. You try a few things, and normally 2 weeks are enough. So for example, if I thought it was soap, I would put off the soap. But if it was soap, it would have come early, not around 8 months. But it seems it comes after baby has been started on these new products. If it is oil, again, put it off for 2 weeks, and again, try it again. Because you've got to prove that what you remove from the diet, for example, or soap and oil is the one which is causing it. As soon as you find out what is causing it, then you ask yourself, how important is it? For example, if the baby takes formula, and we don't want to encourage formula now, we want to encourage breast milk. But if you give a formula and the baby reacts to it, and then now you know that causes it. Now we have an option. Should I pull it off? Should I continue with it? We've seen mothers trying even camel milk, goat milk, but all these other milks are not really for babies. The most important thing is for baby to have breast milk. So what I want this mother to do, 2 things. One, see a gentle doctor. And many of the dermatologists tend to be gentle, and they handle eczema nicely, because whereas they are dermatologists, they don't use a lot of steroids. But many of us think steroids work. What's the danger of steroids? They weaken the skin, and you're going to use a lot of it, and some of it get absorbed into the body. So some eczema is going for a long time. So what the best thing to do is try and isolate what could be causing it. And say, for example, if it was a dairy product, then I would use it. If it was, for example, meat, I would use it less often. And if I had to use a steroid, I would use it when it's very bad. There are 2 types of eczema. There will be that which is dry and scaly and itchy. In those, we tend to use ointments. I think that's what the mothers need to remember, that if you go to a doctor and it's dry and scaly, and the doctor gives you a little steroid to use, it must be an ointment, because it's scaly and all. If it's what we call a wet eczema, this is common around the neck, and the neck is peeling, and when you look at it, it scares you. That is wet eczema, and you most likely benefit from a cream. Knowing that you use a cream or an ointment is important. But there are milder things in the market that we can use, like things like just an aqueous cream, some things just called moisturizers. And for us as doctors, especially pediatrician, we think that it's the mothers who worry about the eczema more than the babies. Sometimes just the roughness that scares the mother. But if the eczema is itchy, a lot itchy, what do I do in my clinic? I use calamine lotion. Just put the calamine lotion on it. And many of you know calamine lotion. Neither tunatumia mtoto akuwa. I'm trying to remember the word of chickenpox in Swahili, but I can't give it to you. Chickenpox, that's a white thing that we use. Just shake it, because when you put it down on the shelf, it tends to settle. So shake it and apply it just as through the baby, and the baby can sleep through the night. Using things that are a lot of Piriton, the baby's going through, oh, we don't like Piritons. So try and use something mild on the skin, because eczema can be there for a long, long time. Much of the good thing about eczema is that in the end it will localize. It may just be here at the elbows and behind the knees, and the rest of the body will be clear. So if you buy time using mild things, you're better off than using very strong drugs. Don't buy steroids from chemists directly, because some of them are very aggressive on the skin. Go to the doctor, talk to the doctor, and whenever you talk to the doctor, ask the doctor, can I avoid a steroid? There's something new in the market called Physiogel. I think mothers here have used it a bit. One is a lotion and the other one is a cream. It allows you to spare the steroid and only use a steroid when the eczema is bad. Because sometimes you get what we call exacerbations. It cools down, then again it comes up, and that.
Okay.
Could I add something? Sorry, I'm an obs guy, but this is just from my experience. Pure aloe vera jelly also works very well. Okay, I don't want to mention the brand here, because I'll be of marketing. But pure aloe vera jelly, you apply it on the skin and then apply something like Vaseline or olive oil on top, just to lock in the moisture. And it works really, really well. And that way then you avoid using the steroids and use them just when there's extreme exacerbation, like Dr. Wafula has mentioned.
Okay. It's been a pleasure having you, Daktaris. Coming to our studio is our greatest joy and happiness. And we also want to thank our partners out there. And because we are marking 5 years since Doctors on Call was initiated, thank you very much for your support, and thank you very much for all those people who haven't even taken the step. And we believe that by now, right now, you are going to take a step that we are going to keep Jesus on the airwaves. And thank you very much to members of our audience, from all of us in the studio. Thank you very much, and may you continue keeping Jesus on the airwaves and have a pleasant viewing.